20 plus mental health and social well-being consultants who offer counseling sessions to people of diverse groups. Also, we work on introducing green zone philosophy in collaboration with Dr. Khalid Sohail to different cities and different social groups across Pakistan, and we have mobilized more than 2,000 people regarding that since 2022. So this particular webinar series, this was idea by Dr. Khalid Suhail, where we decided to pick up one of the psychological issues and dedicate 2 hours long session to it and discuss that particular problem from different dimensions, from the perspective of the survivor, then some expert insights on that problem, also some general questions by the audience and some questions by the patients regarding that problem will be addressed in these webinar series. This series will be recorded for the purpose of for educational purposes, and it will be used for enhancing the awareness of people regarding this particular problem for our audience in Pakistan and abroad. So to make these sessions inclusive for the audience from Pakistan, our volunteers will be helping for the translation of the content, the important highlights from these discussions. They will be translating them into Urdu, and people, they can check the chat box. You can find the translation, the live translation there. So over to Dr. Khalid Suhail. Now he will give further introduction and the objectives of these webinar series, and then he will go ahead with the discussion on the PTSD. That is our first topic for this series. Thank you, everyone.
Thank you. Before I start, I just wanted to check whether Bernadine is there. Did you see Bernadine? Is she there?
Yes.
Okay. Okay, good.
I'm here.
Okay, great, great. Because I can only see one screen at a time, so some people I miss,
35 people are here.
Yeah, okay. Good. So thank you, Muqaddas. I think I'm very excited. Feel very passionate about this project. And I want to, before I formally introduce the subject, I want to acknowledge that this would not have been possible without the support of many, many people. There was a black elk was a chief, a native Indian chief, and Black Elk used to say that no great thing in the world can be done by one person alone. So this is a teamwork, and in this team there is a Pakistani team. Muqaddas Kulsoom and her Naaye Khwaab means new dreams. They have this organization, and in the Canadian team, you see Betty Davis is there, Summer is there, Zahra is there. People who helped me technologically. Warda, my niece, Uzma Aziz from Malton Women Council. We invited some students, Ritesh, Eden, they are the students. And then Dr. Kamrani, a very dear friend from Pakistan. Umar Farooq, another student of psychology. And the people, Bernadine, and next time we will have Shannon. So all these people, I have written books with them. With Betty, we wrote the 7 Steps Green Zone book. With Summer, we wrote a book on Green Zone in Urdu. With the Muqaddas, we wrote another one for Green Zone book in English. So I just wanted to acknowledge. So this group that we are forming, it is not only from the East and the West, it also has many generations. So some of you know, I'm in my 70s, and there are people joining us who are in their 60s, 50s, 40s, 30s, even 20s. So we are crossing, I think Eden might even be a teenager. So we are crossing 50 years, half a century. So I feel very excited. And I think if these seminars, these workshops are helpful, you people will give us the feedback after the seminars, and Muqaddas will make sure that we can provide this service basically for mental health education and for sort of the creativity, promoting creativity, so that more people can join, Mukaddas, is it possible to show the PowerPoint slide? Is it possible? Otherwise, I can do it without it.
Yes, Dr. Suhail, I am trying to open those slides. We have some internet issue here.
Yeah.
Meanwhile, you can start your
So,
presentation
so don't
and
don't
I can open it.
so don't worry. Then I can I can just do without the slides. That's okay. You know. Okay. So the topic today is post-traumatic stress disorder. So we are having these sort of programs to inviting people so that you can hear the life story. Giving a lecture is one thing, but when you will hear the story from Bernardine, I think that is live, that is a real story. And then when you will hear the comments from Betty, from Naeem, from Dr. Kamarani, so these are the real live discussions that you will hear the real life stories. One of the points of doing these things is to remove or deal with the stigma of mental illness. We all know that we can talk about our physical conditions. If somebody has bronchopneumonia, somebody have ulcerative colitis, somebody even have a cancer, they can talk about it. But when they say somebody has panic disorder, somebody suffers from depression, somebody's family member has schizophrenia, there is a lot of embarrassment, there's a lot of shame, there's a lot of stigma. So this kind of discussion will deal with that. And I'll start with my own personal story to share that when I was 10 years old, I witnessed my father, who was a professor of mathematics. He had a nervous breakdown. He was taken to the hospital, to the mental hospital. He was given shock treatment, and then he recovered. And when he recovered from a person who used to wear suits and ties, silk ties, and clean shaven, he became very religious, very spiritual. People start calling him Sufi Saab. So that was a mystery for me. And I think that might have inspired me to explore mental health, explore sort of medications, explore psychotherapy. I also learned that person suffering from emotional problems does not suffer alone. It affects the whole family. So many of you who know that when Betty and I, help people in our clinic, we used to invite the spouse, invite the partner, invite the children, invite the parents, invite dear ones. So the whole family was sort of involved in therapy. So I feel that in mental health, the whole family sort of needs help. We also recognize that mental illness is also related to creativity. So we promote creativity because we feel that creative adventures, creative gift helps people to recover, heal from the therapy. That is why when we published the book with these 60 stories, we named it Creative Birth. So the creativity has been a very integral part of what we do in our clinic, so that's part of, so we will, in our series, we will be inviting people who are creative, their parents, their children, and how creativity and emotional problems are linked together. So focusing on the PTSD. So if you go looking for a definition, it says that PTSD is a mental health condition triggered by experiencing or witnessing a terrifying, life-threatening, or deeply traumatic event. So it is not an ordinary emotional problem. It really shakes the person. It really affects them at a very deeper level. The awareness of post-traumatic stress disorder in the professional circles started in 1980. That's when American Psychiatric Association, they have their classification. They call them DSM 1, 2, 3. So in number 3, the PTSD came into the diagnosis and the discussion. But at that time, it was only limited to the natural disasters, like floods, earthquakes, wars, accidents, murder, very, very serious traumatic experience. But gradually, professionals realized that the symptoms of PTSD were not only people who were facing the war, the refugees, but also in our day-to-day lives, in the general public, in the different families. So that is where the concept broadened. And by 2013, the DSM-5 from DSM-3 in 1980 to DSM-5 2013, in like almost 25 years, the family violence, the domestic violence, the physical, emotional, sexual abuse, that all came part of the post-traumatic stress disorder. The key factor in that was that it is not the event, it is also the sensitivity of the person. So people with a personality who are highly sensitive, they can be traumatized with things that maybe some other people may not. So on the spectrum of the sensitivity, the people who are more resilient, especially people who had a very good upbringing, nurturing upbringing from good, healthy parents, healthy families, healthy schools, healthy communities, those children, when they grow older, they are more resilient. Their constitution and their upbringing is stronger. But the people who had experienced, childhood trauma or abuse or neglect, they are more sensitive and they are more affected by that. So that is how the concept has broadened, that it is not just the event, it is the event and the sensitivity of the person and the personality of the person that together sort of work together to create this situation. Now, some of the symptoms, although there is a wide range, it starts, people become obsessive about what the event that happened that really traumatizes them. They start to have flashbacks. It affects their sleep. They have nightmares. They start having anxiety, panic attack. Some of them have dissociations. They even get depressed, become very suicidal. Because of their emotional sensitivity and the struggle, it affects their relationship with the family, with their dear ones. Because if they are dating, then the person who they're dating, he or she may not be aware that the person has PTSD, and their reaction might be different. So basically it affects. We will be having two sessions of PTSD. Today we will be focusing on the adult PTSD, and the next month with Shannon we will go into some of the childhood experiences, that how the childhood trauma, sometimes repressed for years, people may not even remember that it happened 5, 10, 15, 20 years ago. And sometimes in therapy, then it comes to the surface and people have, to deal with that. And then some of the other therapy, I usually say that therapy can transform a breakdown into a breakthrough. So people not only go back to before the crisis, they even become stronger, happier, more peaceful. They become wiser, and that's why we feel that the therapy is like a learning experience. You learn, and then you grow, and then you share that with the world. So the treatment is very multifaceted. The symptoms can be dealt with medication, like a sleep disturbance, anxiety, sadness, but that is not the real of a treatment. That is just a symptomatic treatment. It's like if somebody has bronchopneumonia and they have fever, you give them aspirin. So aspirin is good to deal with the fever, headache, but not the infection of the lungs. So then we have to go deeper into with antibiotics and other nutrition education. The same way with PTSD, there is a wide range of experiences, professional experiences. And Betty and I have created in our clinic, we call it a combination therapy. It starts with individual therapy, then go to relationship therapy, then goes to family therapy, then goes to group therapy. So that's a combination, because many people might need many kinds of therapy, and it might change. Their needs might change from medication to individual therapy to family therapy to group therapy. So we go in our clinic, we used to go with the person's needs, the person's readiness, we would assess, and Betty and I will provide a combination therapy in two-parent model. Many clinics only have one therapist. It's like a one-parent, single-parent model. So Betty and I used to provide a two-parent model, because some might connect with Betty because she's far more nurturing, and I'm a little more sort of a challenging. So my role was a little more fatherly, her was more motherly, but it was a good combination. Before her we used to have Anne, and sort of. So I'm just sharing with you that what sort of our approach to therapy, our approach to mental health problems. And some of you are aware of the green zone therapy. In that, we focus less on the diagnosis and focus more on the people's gifts and the talents and their healthy part. So we feel that the healthy part, when it grows, the unhealthy part goes into the background. So it is not just an illness oriented model. Our model was more health oriented model, growth oriented model, creativity oriented model. So I think these are the some of the factors that I want to. So this is more theory, and each person is different. So you will hear today one story, and then you will hear another story next time, another story next time. So hopefully each month, if you stay with us, then you will see how different forms of expression, the emotional problems, and different forms of therapy, they all work together. So I leave it here. Let me see where Bernadine is, so that I could have a little interview with her. Bernadine, can you, I don't know, in this technology, maybe have to ask the help. Bernadine, can you appear on the screen some or the other? I don't know.
I'm not sure if I press on
Yeah, here she
myself
is.
whether.
Okay, good, good. Now I can see you. Okay, okay,
Okay.
okay, wonderful. Thank you, Bernadine, for joining us. This You are part of the main course of today's presentation. So I know it's not easy to talk to so many people, but I'll try to help you and go along. So I'll ask you a few questions, and hopefully you can feel comfortable answering them, so that people know your real story. Don't feel the pressure from me or any person when they ask you a question. If you're not comfortable, you can just say you pass, or you send it back to me. So Bernadine, let's start with your childhood, so that people have a sense of you as a person before the problem. So share with us the family that you grew up in.
So my parents met and married very young. And in a sense, I believe they felt that they were rescuing each other. My dad was an orphan. His mom died when he was 4, and his dad when he was 16. And so he was shuffled between different family members and separated from his own siblings and whatnot in order to place them in households where they could have some type of parental simulation. And my mom was a fantasist living in a very strict Catholic traditional household. She was an artist, very gifted in being able to paint and draw. And she actually received a scholarship under one of the painters from the group of 7, which she took a few sessions in and then passed on in order to run away and marry my dad. Um, Initially, she didn't think she could have children. She didn't get pregnant right away. Took fertility drugs, and eventually they had 6 children. And I am the second oldest daughter. Um, they had 5 girls and 1 boy, my brother being the youngest. Um, anyway, life growing up was very volatile. Mom suffered from severe mood swings, and we lived on eggshells. We never knew from one moment to the next or one day to the next what to expect. She, being a creative artist, she loved singing, she loved poetry, she remembered songs and poetry. And one day one moment she'd be singing songs and reciting poetry, and the next she would be in a fit of rage. And then she would suffer from depression and lock herself in her room for days. Oh, sometimes hours, sometimes days. Anyway, dad put in place the responsibility of keeping mom happy, or, her moods as level as possible, on us older children. And my mom placed the responsibility um, of showing dad what love within a family could look like, because he didn't have, you know, a loving, stable, secure childhood himself. So my role in the family from a very young age became the fixer or the peacemaker.
Okay. How did you do in school?
Actually, academically, I did very well, even though my parents were from an English speaking family. We lived in the Montreal, outside the Montreal area during the 60s, and they felt it would be advantageous for us to learn French. So they did enroll us older ones in an entirely French language school, Catholic school outside of Montreal. And I attended that school up until grade 4. I actually was awarded an honorary pupil certificate with when I was in grade 2. And I do remember the teacher shaming the other children in the class, which made me feel very uncomfortable because she was saying, here's an English student who's won the high student award, and you are the French kid. So I found that a little bit awkward. But anyway, I graduated from high school with honors, and I did take a few computer classes in college, as computers were just being introduced to the world and whatnot. But while I was still in high school, I was given the opportunity to explore a career in banking, and I worked on Saturday mornings at the bank. So when I graduated, I really wasn't sure. I'd taken some secretarial courses, accounting. I liked working with people. And so getting into the financial industry seemed to be a good fit for me. And so I did work in the several different financial institutions in many different roles, from 1977 to 1974. And then at that time, in order to have more flexibility to raise my family, I started my own decorating business. I had always been interested in sewing and had pursued, different courses on how to sew and decorating and whatnot. So in 1999, I took on that decorating business. And then in 2012, I returned back into the banking world.
So give us an idea about your experiences in the bank before the crisis, before the tragedy.
So when I re-entered the banking world in 2012, although I had held several different positions within the bank in different facets of the industry, I chose to go back to my roots as a teller. And believe me, the income was humbling, but my goal really wasn't entirely financial. I truly believe that because of my energetic and vibrant personality, that the best place for me, and then how I could be the best asset to the bank, was to be the first impression as customers came in. And I relished in the idea of bringing humanity back into the industry. So I was really excited about having direct contact with so many people every day. And it gave me the opportunity to touch someone's life in a positive way. So, in making eye contact, I was making them feel seen by listening, genuinely listening. I felt that I was allowing them to feel heard, and just bringing a smile onto someone's face on a dark day, I found was very, very rewarding. So, and aside from my regular duties, I was asked to head up many different campaigns that were going on because of my enthusiasm and my creative incentive ideas and whatnot. And then very quickly, I was assigned to the social committee to bring, team spirit into the branch. And I was rewarded by being nominated and actually winning the title of Best of the Best by my peers. And when the head teller position opened up because the one girl retired, then I was offered a full time position.
Yeah. I think I, from these questions, I wanted to show to the audience that you are highly successful. You are very, enthusiastic, and you are very sort of helping the customers, helping other people, and sort of leading a very successful, productive life. So, share with us what happened that tragic day that the crisis happened.
Oh, I thought you said that magic day, but I think you said tragic
Tragic,
day.
tragic day. Yeah.
But magic in the sense that, you know what, you can come out on the other side and have a breakthrough. So I guess we can consider it both. So on August 9th in 2018, two armed men entered the bank, waving guns and forcing their way behind the counter into the teller's workspace. I was singled out and forcibly dragged by my arm between each one of the teller's wickets as, I was being directed to and, um, you know, aggressively asked to produce money. Um, and during the entire duration of the robbery, I had a gun at my side at all times. And as their anger escalated, so did their voices, and their demeanor became more aggressive. And doors and drawers were being ripped off their hinges, and papers and files were going flying, and they were, rattling on doors, trying to get into whatever space they felt there may be money hiding in. At one point, I did have two guns on me at the same time. And when the man handling me became very agitated because I wasn't producing the large amounts of cash that he was looking for, he actually cocked the gun at my side to further threaten me. So I truly felt that I was going to die that day. Um, and anyway, I think, I mean, the entire thing was very traumatic, but when at towards the end of the robbery, they, kind of threw me to the ground, telling me to kneel. Yeah, they asked everyone to kneel facing the wall. And at that time, I the faces of my family flashed before my eyes, and I thought that we were going to be shot execution style. We were facing away from them. We knew they had guns pointing at us. And the fear became so intense. I closed my eyes and I went so deep, within myself that I could actually no longer hear anything. It was like just such a surreal experience. I didn't even really couldn't identify whether I was already dead or still alive.
Okay. I know it's very painful to even talk about it. So I'm thankful that you are sharing all that with us. So let's go a bit fast forward. What were your symptoms, and what were you struggling when you came to the clinic for this issue to get help? What were you struggling with emotionally at that time?
So I had already been fully assessed, thoroughly assessed by a psychiatrist. And, of course, it had been a psychiatrist that was assigned by the bank. Um, and he did diagnose me with PTSD, post traumatic stress disorder. Um, I had been literally hiding in my house, for many, many months, paralyzed with fear. My nervous system was stuck in that fight or flight state. And I was unable to perform routine daily activities. I had lack of motivation, fatigue,
If you can please
lack of.
mute your sides. Uh,
Go ahead,
Um,
Bernadine.
yeah, so as I was saying, I was having difficulty performing daily tasks. I had lack of motivation, fatigue, lack of concentration. I wasn't able to sleep. My mind kept reliving, the horrific scenes of the robbery, having flashbacks. And if I did eventually fall asleep, my sleep was very disturbed, was restless. I had night terrors. On occasion, my husband would wake me up because I was hitting him, thrashing, feeling that he was, fearful that he was a predator. Um, I suffered from paranoia. Um, my trust in the system was no longer there. I had panic attacks, anxiety, depression, um, self doubt, anger, hostility. My relationship with my husband and my family and friends was strained. It was difficult for um, people to understand why I couldn't just, shake it off and get on with life. Um, so I was in a very, very dark place.
Bernardina, would you be okay if I read a few sentences from your story that you shared in the group?
Yes, that's
Okay,
fine.
okay. So I think Bernadine shared her story in this book, The Creative Work. So I want to read a few sentences so that give you an idea. She writes, I was lost, broken, unsure of who I was, what I stood for, what I believed in. I no longer trusted my own judgment. I had spent almost a whole year too fearful to leave my home. Even within the security of my own home, I not only suffered, but so did the rest of my family. I woke up screaming and thrashing from night terrors. I had trauma response. And I think this is, I want to highlight what people who have never experienced trauma may not realize what the trauma response is. And she has articulated it very well. I I had trauma response to the toaster popping, the oven beeping, the doorbell dinging, the phone ringing, and the grandfather clock chiming. I jumped screaming whenever a family member turned a corner or I saw my own reflection in the mirror. I think that's a very strong, powerful sort of articulation that how the person's whole sort of life is turned around. So thank you, Bernadine. Now share with us that how therapy helped you. So this is like 7, 8 years, and tell us how you are different today than when you first came for therapy.
Well, I was fortunate enough to be introduced to Bet at the clinic about 20 years ago, and she was very instrumental in helping my husband and I recover from a business venture that we had moved to another country, and the kind of business adventure kind of went sideways. So we were bringing, three teenage children back to Canada without a home to live in and whatnot. And we're going through some, difficult transitional times. And so she was there to support and help us and guide us through that. Um, Not just myself, but again, as Dr. Sohail explained, they work in a holistic sense. And so she helped me, she helped my husband, she saw some of my children and guided us as a family through this transition. So when I reached out to Bat after the robbery, she recommended that I see Dr. Sohail. And because there was already a level of trust established with the clinic. I felt comfortable. And so when I met Dr. Sohail, or met you, Dr. Sohail, you made me feel safe. And when I shared my experience with you, you listened with patience and kindness and an open heart and mind. And I felt that you truly understood the depth of my trauma. Um, you didn't diminish, you didn't try to diminish the feelings that I was experiencing, or, try to convince me that, this was over the top, or, I was making much ado about nothing, which were the sentiments that I was getting from my place of employment in the insurance company, and the supposed, independent individual that they were, giving us access to directly after the incident. And that person had not even briefed themselves on the circumstances of the robbery, and, was telling us that, we should just let it go. And 9 times out of 10, it's just a note that's passed, and, get over it. Your lives were never in danger, that kind of thing. So, um, I didn't get that sense from you. You acknowledged my feelings, not only acknowledged them, but you validated them. And you and Bet also helped by, exploring my background. You helped me understand, why I acted as a first responder. Because of my position within the family dynamics, I had taken on a parental role, not just with my siblings, but with my parents on, you know, several levels. And so it was my natural instinct to dive in and protect my colleagues, take the attention away from them, and, try to keep them safe and secure. So, you gave me the space and the time to process all of this. You encouraged me to write about what I had experienced. And, you and Bet both helped me appreciate and take pride in how courageous I was during the circumstance. And you helped replace my feelings of shame, guilt, and self doubt that others had placed upon me with understanding, confidence, and pride. So, and the clinic didn't just work, with me one on one, but that encouraged me to participate in weekly group sessions. And those sessions, have been and are an inspiration and a wealth of knowledge and encouragement and support for me. There are many members of the group who have suffered on different levels, and they get together and don't, they're getting together to establish growth within themselves. So it's very encouraging and inspirational to be a part of that. And I'm married and have 3 children. As Dr. Sohail said, he understands that the trauma just doesn't affect the individual, but it has a domino effect and extends to the members of your family. And so he was very open and accommodating to meeting with my husband. We had some strain in our relationship. He hadn't never really experienced a life-threatening experience. And so, he was having a difficult time understanding and supporting me, knowing how to respond to my really um, wild reflex expanses. And like most people, they chuckle. They think it's funny when they see you like have these startle reactions. And with help, he learned to put his arm around me when that would happen, and breathe with me and help me process through that. So Dr. Sohail was helpful with my family to help them understand the symptoms of PTSD. And so they were able to have a more loving, responsive way of supporting me.
Okay. So I know there's a lot, and I think because of the limited time, I apologize to sort of leave it here so that we can have some feedback from the other people who are watching. So thanks, Bernadine. I've seen you grow. I've seen you sort of gain that confidence. I've seen you sort of like yourself, in your self-esteem, self-worth, self-confidence. I think somebody has asked me the question. I think the people are already asking questions, that what was it for me in the process. So I think I could not have done it alone. As I said, having Betty there, having the group therapy, all those people, that was a group effort. And I think that was a very learning experience for me. So I learned many things from you, from your husband, from your children. They are very creative children, and I think I learned a lot. So thank you very much. I'll leave it with you here so that I can get some input from other people, professionals, and other people who are in the audience. So thanks, Bernadine, for sharing your story. Now, let me go to the first, our co-therapist, colleague, a good friend, Betty. So Betty, you had known her, Bernadine, far before I did. So maybe you can start with your input so that people know what has been your observation. Betty.
Thank you so much, Sohail and Bernie. Congratulations. Excellent, excellent job. Thank you so much for sharing this morning. It's been a privilege to witness Bernie's healing journey. She has evolved from a victim of violence and abuse to a survivor, to a thriver, to a powerful warrior and advocate. Over 45 years ago, when I became interested in working with people who had experienced trauma and violence, it was because I too had come from a violent background. I wanted to heal myself and not repeat the violence in my home. I wanted to help others heal and become empowered. At that time, I knew so little, and the mental health world knew so little about PTSD. But what I did know for sure was that one of the paths to healing was doing what we did today, bearing witness to somebody's trauma, listening to their stories, validating that speaking their truth is vital to their healing journey. Something you may not know about me is that I have a science background and I love hearing about the latest research in mental health. So I'd like to touch just a little bit on a few new pieces of knowledge. At first, PTSD was primarily thought of as a mental condition. Now, through research, we know that it affects the whole person, the brain, the body, and even the immune system. Another delightful development has been research in private labs, such as those led by Dr. Andrew Huberman. He's a neuroscientist at Stanford University. One of his areas of focus has been on reducing symptoms by understanding the brain's natural ability to manage fear and stress. He has looked at our simple but enormously powerful breathing patterns and how they can rapidly reduce anxiety, panic, and fear. One technique he calls the physiological sigh. The physiological sigh. It sounds complex, but we do this type of breathing when we're sleeping, when we're waking, but especially when we've been crying. You may be able to relate to this, that sometimes we have this when we sob, when we cry, there is a way that we intake, the way that we breathe. This particular technique involves taking a double breath in and a long exhale out. When we've been crying, we sob. That's the double breath. So that's the first part. You breathe in and then breathe in and to top it off, and then release in a long breath. What he also found was that the long exhale by itself is even powerful because it tells the alarm part of our brain that we are safe. So these are very simple concepts, but they're incredibly powerful because they tap into the magnificent power of the brain. Perhaps one of the most exciting developments in the research world is the movement towards personalized treatment. Researchers have discovered what Dr. Sohail and I have always known, and that is PTSD and many other mental health issues are not the same in every person. As we look towards retirement, he and I look towards retirement, it is incredibly validating to learn that the individualized care, that combination therapy that Dr. Sohail talked about, we've been offering that for decades now. And now it finally gets a stamp of approval through research. In closing, I want to leave you with this final thought about PTSD. Trauma is like writing a story with permanent ink. We can't erase the words that have already been written, but healing gives us back the pen so that we can write our own stories. How exciting is it that the next chapters don't have to read like the first ones? Bernie's opportunity to relive and rewrite her story is what we are witnessing today. And thank you for being part of her healing journey.
Thank you. Thank you, Betty.
You're welcome.
I agree with you that therapy could be seen as rewriting one story and even looking at the past with a different perspective, different angle that changes our perception of ourselves. So thank you very much, Betty. Now let me go to Summer. Let me see where she is. Summer Ishtiaq. She and I wrote a book together in Urdu on Green Zone philosophy. With Betty, I had written the Seven Steps book, and with Mukaddas, we wrote the Green Zone philosophy. So there are different books that I've written with different people. So Summer Ishtiaq, where is she?
I'm here, Sosa.
Summer, come to the screen and say a few words, your thoughts, your impressions.
Sosa, can you see me?
Can
Hello?
we see Summer?
I can see you.
Yeah, okay, you go ahead. I cannot see you, but you go ahead.
Okay.
Okay.
Hello everyone.
Okay,
I'm
now I can
Samar.
see. Okay,
Can
now
you
I can
hear me?
see. Yeah, now I can see. Okay, go ahead.
Okay.
Okay.
Hello everyone. I am
Yeah.
Samar Ishtiaq and I am a special educator and community mental health counselor working for the Peel District School Board. Thank you, Sohail Saab, for inviting me for this seminar, and thank you for organizing this seminar. I appreciate your initiative, warmth, and ability to create a safe and supportive space for learning and discussion. Thank you, Brandine, for sharing your story with us today. I recognize that speaking about such painful and personal experiences can be difficult, and I appreciate the trust and openness you have shown in us. As I listen your story, before before and after the tragic event, it became clear how profoundly this experience shaped your beliefs about yourself, other people, and the world around you. What stood out to me was the lasting impact of trauma on the sense of safety, trust, and emotional well-being. Um, while I was listening your story, I was particularly interested in your response to the event as a first responder. And it made me wonder how your childhood experiences and family role may have influenced your instinct to step in, take responsibility, and help others during time of crisis. And later you confirmed uh, that you are aware of this fact. Um, the interview highlighted not only the severity of the trauma, but also Brendan's remarkable resilience. Um, when she spoke about her work, her passion, dedication, and compassion for serving others were very evident. Those qualities seems to be important strengths that have helped her negative, difficult experience throughout her life. Overall, I found this interview to be a powerful reminder of both the enduring effects of trauma and the resilience that individuals can demonstrate in the face of adversity. Thank you again, Brendan, for sharing your experience, and thank you, Dr. Khalid Sohail, for facilitating such a meaningful discussion. Thank you.
Thank you, Samar. I mean, those of you who know Samar and I and Zahra, we had conducted some seminars during COVID, and I think she has been a very sort of inspiring influence on people who joined us. Thank you, Samar. Now I think Zahra is there. Zahra, would you like to say a few words? Zahra, come to the
Sure,
screen.
so
Okay,
sure,
go ahead.
Sultab, thank you. Um, I would like to say to Brendan that thanks for sharing your story. And when you started talking and you changed the word from tragic to magic, you stole my heart that moment. So thank you for that. You changed that story, like you claimed the whole thing, which was very courageous and an inspiration for other people to heal. Um, I would like to talk for a moment about how we define the word trauma. For a long time, I think many of us looked at trauma as the bad thing that happens to you. But everything clicked for me when I came across Dr. Mate's definition. He explains that trauma isn't the external event itself, it's the internal psychological wound you have left with as a result. It's about how that experience shapes your internal beliefs, your rigidity, and your behavior moving forward. When I looked at this way, I finally answered a huge question for me: why it is easier for one person to bounce back from an event than another. Think about two people sitting in the exact same car during a car accident. They encounter the exact same physical event, but their internal trauma can be completely different. The long term effects, the healing timeline, it all changes because they experience the event through different internal lenses. It literally becomes a different trauma for each person. Setting my mindset to this definition gave me a powerful tool to push back against victim blaming. It completely changed how I approach my own clinical work. In practicing trauma informed care, I have learned to stop looking solely at the event and start focusing deeply on the individual experience. Thanks very much. I just want to introduce myself. I'm Zara Nakwi, and I'm a mental health and addiction worker in Toronto, and I'm also a psychotherapist. Thanks very much. Bye.
Okay, thank you, Zahra. Zahra has been part of our Green Zone team and has been helping me many years, decades maybe. So thank you. I think we are getting input from the professionals. These were my Canadian friends. There is one friend in Pakistan, Dr. Santosh Kamrani. Maybe Dr. Kamrani can say a few words. Dr. Kamrani.
Thank you very much. Is my voice audible?
Yeah, go ahead. Yeah.
Okay, thank you very much. Dr. Sohail, thank you very much for providing this opportunity. I'm Dr. Kamrani, your student, your direct student, and you are my guru.
You're a good friend.
So,
That's a good. Go ahead.
yes, of course. And thank you very much from this story. And as I have spent many years with you and our team, Zara and Saman Nakvi and all, Sarah Ali, uh, and my experience as stress management in my practical field. I'm also teacher of human behavior. All this and this meeting, this interview of the lady, uh, from that I have learned that for these type of patients, there are three, four steps which I have learned from your green zone therapy too. That first of all, it is very much important for patient to be self-awareness regarding the guilt or regarding the anger, whatever he or she is experiencing, and the survivor mostly blames himself or herself. Self-awareness is very important stage uh, to know that this is not his or her guilt, and anger is not the remedy. Uh, then the second step, I think, uh, is very much important, which Green Zone therapy also tells us, that is self-confidence, that uh, you are able, the patient is able to cope up the situation, and the psychotherapist also assures him or her that he or she is capable of coping these situations, these trauma. Uh, then I think the most important stage is, which I also saw from the interview, that is self reliance. That yes, I can cope up and I can do it. So this is very much important for a patient uh, to be self reliant. And after that, as you know, uh, things will go very well. And I think the treatment and the group sessions, group therapy, and one-to-one therapy is also important. It depends upon the therapist, how he or she treats the patient, how he reassure the patient. So I think I'm seeing here the best combination of all these, and the best relationship between the patient and Dr. Sohail. This is my few
Thank
words.
you. Thank you, Dr. Kamrani. You have always been a great friend and a great source of inspiration. And I love reading your articles on Hum Sab. You are a wonderful writer, educator, and inspiration. Thank you. So I think for the people who are attending today, alongside the professionals, we had invited a couple of students. So one is Eden and the one is Ritesh. So let's see if Eden is there, if she wants to say, a few words from her sort of learning. I think we want to sort of train, educate the younger generation. So I think she's the youngest participant. She and I wrote a book together, From Wonder to Wisdom. So she's also my co-author, and I'm a good friend of her parents. So we are like a family member. So go ahead, Eden, say a few words what you think of this whole topic.
Hello, my name is Eden. I graduated high school last month, and I just like to contribute a little bit by sharing some research I did about PTSD and more of the neuroscience behind it. First of all, I'd really like to thank everyone who's participated so far, and especially Bernadine for sharing her story because it's absolutely commendable how brave you were for sharing such a traumatic story, and it's very, very difficult. I hope you can hear me. Um,
Yeah, yeah, we are hearing you. Go ahead.
okay. Um, so I'd like to start. PTSD or post traumatic stress disorder develops when the body's normal stress response fails to switch off after a traumatic experience. Instead of recognizing that danger has passed, the brain continues to behave as though the person is still under threat. The process begins in the amygdala, a small region of the brain responsible for detecting danger and triggering fear. During a traumatic event, the amygdala sends signals to the hypothalamus, which acts as the body's control center for maintaining balance. The hypothalamus activates the sympathetic nervous system, better known as the fight or flight response. This causes the adrenal glands to release hormones such as adrenaline and cortisol. Adrenaline increases heart rate, breathing rate, blood pressure, and muscle tension, so the body is ready to react quickly. Cortisol increases blood sugar to provide energy while temporarily slowing processes that aren't immediately needed, like digestion and parts of the immune system. Normally, once the danger is over, another part of the brain called the prefrontal cortex recognizes that the threat has passed and helps calm the amygdala. Cortisol also signals the brain to reduce the stress response, allowing the body to return to its normal resting state. In people with PTSD, this system doesn't work properly. The amygdala becomes overactive, so it reacts strongly even to seemingly harmless situations. At the same time, the prefrontal cortex is less effective at controlling these fear signals. Another brain region, called the hippocampus, helps organize memories and distinguish the past from the present in PTSD. It may not function as effectively, which is why reminders of trauma can trigger flashbacks that feel as though the event is happening again in the present moment. Because the brain continues to send danger signals, the body also stays in a heightened state of alert. This can cause symptoms such as a racing heart, rapid breathing, sweating, shaking, muscle tension, difficulty sleeping, and an exaggerated startle response. Over time, constantly activating the stress response can increase the risk of high blood pressure, heart disease, and digestive problems, also a weakened immune system. Scientists have also found that PTSD can change how different parts of the brain communicate with one another. Thankfully, these changes aren't permanent. Thanks to neuroplasticity, the brain's ability to adapt and recognize, therapy, medication, exercise, and other treatments can help restore healthier patterns of brain activity. PTSD is much more than just a psychological condition. It's a disorder that affects the brain, the nervous system, and nearly every major system in the body. Understanding the neuroscience behind PTSD helps us see that it's a real medical condition, not just a sign of weakness, and that one can improve with the right treatment. Thank you so much.
Thank you very much, Eden. You can see how young students, they are so into research, and she is such an inspiration. She introduced me to a new word. Those of you who do not know, she wrote me a letter one day and she called me Dear Grunkle. I said, what is this? She says, Grand Great Uncle. Oh my God.
Yeah.
So I have become her grunkle. So, and we wrote a book together. So thank you very much, Eden. I'm so proud of
Thank
you.
you.
Okay, thank you. So the next student we invited is Ritesh. Ritesh Rohan is a medical doctor who's becoming a psychotherapist in Canada. And just to let you know, the third episode, the first is with Bernadine, the second is with Shannon, and the third will be with Ritesh from a different angle. So Ritesh, can you share your thoughts about this topic? Ritesh. We can't hear you. Can you put your sound mute, unmute yourself? No, no sound. Because when the seminar started, we could hear you. No? Okay. So anyhow, what I can do is go to somebody else. You get ready, and then I'll come back. I also saw no, there's no sound. Yeah.
Start again.
Try again.
Try to start again your system.
Yeah.
Hopefully it will
Now,
work.
can you hear me now?
Yeah,
Yeah.
yeah. Okay, good.
Oh, okay.
Okay, good.
Okay.
So go ahead,
Thank you. Thank
Ritesh.
you.
Yeah.
Thank you for this.
Yeah, we lost you again.
You muted yourself.
Yeah.
Ritesh, you muted yourself.
Oh, now? Is
Yeah,
that
now
okay?
it's good.
Okay,
Not
I'm not
don't
gonna
touch
touch
it.
It's
it.
better now.
Yeah, okay.
Okay.
Yeah, we can listen you now. Thank you.
Yeah.
Thank you so much, Dr. Sohail, for this opportunity to let me talk here, and thank you, Bernadette, for sharing such a story. It's not easy to share that, and I really appreciate that for us to learn too. And Eden covered a lot of things that I did want to speak about, but I will circle back and give a short narrative. I wanted to reiterate the wordings that Miss Bernadine used. She said she felt like she was reliving, she was paranoid, she felt like she had decreased trust, she had panic attacks, she was anxious, felt anger and had nightmares, and also felt like an existential feeling. And the relational aspects, the relations that she had with each other, with her circle, also was affected. And she was hyperstimulated. From what we've read, she was stimulated by a lot of many micro sounds, and stimulations basically had an effect on her. And then I just wanted to reinstate what Eden said about these things. These are manifestation of how she felt, but it all starts from different regions in your brain. Insula, for example, has the inner sensation, the butterfly feeling you have, the inner gut feeling you have. Insula is the part that we sense that. And then comes amygdala. We basically, if we see something move in the bushes, if you're in the forest, amygdala quickly detects if it's a threat or a not threat. So it detects the threat. And in these kind of experiences, it's hyperactive. So the threat almost feels like it's happening right now, and it's hyper responding. And then comes the brainstem. And brainstem is important here because all the physical sensations that we feel, all the experiences, the traumatic experiences, kind of imprints in the brainstem region, where the breathing, where the brainstem is responsible for some of the visceral sensations like breathing and sweating and all those senses we have during post-traumatic stress and panic attacks. The brainstem gets activated. That's why we feel that way. And the hippocampus, contextual and memories, it's responsible for context and memory. And as Eden pointed out, it almost feels like it's happening now. That's why when we hear something about the story, or gunshots, or anything that traumatize us, it almost feels like it's happening right now. And hippocampus cannot make it out. And also, along with how the prefrontal cortex, which is the processing unit of your brain, usually cuts it off by saying, hey, it happened back then, now everything's fine. That kind of processing gets affected because of the trauma. So all of this works together to give us feeling everything that Miss Bernadine basically expressed as the symptoms. And one of the things that I do want to give a perspective of is, as a student, I wanted to write down my learning points from what was discussed. So firstly, because Ms. Bernadette said what all helped, and I've noted these down, and I wanted to put that in my head and practice it. So strong therapeutic relationship, Dr. Sohail and Beth. Strong therapeutic relationship is everything. And she felt safe. So providing a safe space for her to express and understand the depth of the experiences rather than listening to the story. And didn't don't not trying to diminish the story so that we can understand it fully on so many different angles. And acknowledgement and validation is important, and I wrote that down and highlighted it. It's important for us to acknowledge how they feel rather than what it is, and a space and time to process and to write things down so that we can express fully. Sometimes we don't verbally say it, we cannot say it, but when we sit down and write down, we have to force ourselves to write so it expresses more. And appreciating the strength, because uh, Miss Bernadine said that when you appreciated her strength of being courageous, it really helped her. I could see how much it helped her. So I thought that you have to identify the strength and point that strength out, because our processing cannot look at the strengths immediately when we have had a trauma. So it's important to point out the strength and appreciate the strengths. And then noticing how trauma bleeds into the family, getting the family involved in therapy also gives the person another space where they're mostly there, to give them a safe space to be. And some grounding practices. Some of the points that I wanted to mention, Beth already mentioned about the breathing, Andrew Huberman's point. And I also wanted to just talk about, not talk about, but just point out that some grounding practices, like bringing your senses to, like, let's say, touching the floor or the smell or primary sensations like that, which is immediate, just looking outside the window, looking at the shadow, looking at the mat, like bringing your focus to the immediate sensations will also get you out of that feeling. So that I just wanted to point that out. But there's new treatments and research that's happening. That's for another conversation. But one of the things that I do want to end with is that Dr. Sohail pointed out that PTSD is not only about the trauma, but it's also about the sensitivity. And with how Miss Bernadine has said, she's a loving, kind, and sensitive person. I really appreciate that she was so sensitive and loving and caring that an experience like this actually had an impact on her. And I want to point out that it also means, Miss Bernadine, that you are such a kind person and something unfortunate happened to you. We're sorry about that, but I'm so happy to know that you had a wonderful support system to help you through. Thank you.
Okay. Thank you, Ritesh. And I just said that Ritesh has been a wonderful student. He came to our clinic and he contributed to the book. So those of you who has been reading Creative Birth, you will find his letter that he wrote to me, and I wrote a response. It was a wonderful exchange. Thank you, Ritesh. I really appreciate it. I also see Naeem Ashraf here. Naeem Ashraf Saab is a wonderful friend. He translated my book Creative Minority in Urdu, Takhliqi Aqliyat. It is such a thick book, I could not have translated it myself. So I really appreciate him doing that work for me. Naeem Ashraf Saab, is he there or is he left for, I can see his, uh, I don't see Naeem Ashraf. I think his seat is vacant. It's empty. He is. Okay, so I think I saw Wayne, you were there. In the beginning, I saw Wayne. When did you want to make any comments? Or Sara Ali? Did you want to? Okay, I think he came back. So Naeem Ashraf Saab, we are talking about you. So put your headphones on and share your. I was praising you for translating my book Creative Minority into Urdu. So you are in Calgary. So share your thoughts for a minute. You are mute. Can you unmute yourself?
Yes. Can you
Okay.
hear me now?
Now we can hear you. Yeah, go ahead. Go ahead.
Okay. Dr. Khalid Sohail, Muqaddas Majid, and team Naaye Khwaab, and participants, I feel super excited to participate in this very unique and important seminar this morning. My name is Naeem Ashraf. I live in a small city of Calgary in Alberta. Ladies and gentlemen, there cannot be anything more worthwhile than to serve the humanity. There cannot be anything more exciting than paying back to society. There can never be anything more rewarding than turning agony of human beings into comfort. I have just reviewed Dr. Sohail's book, Creative Birth. That tells the stories of breakdowns into breakthroughs. In each story, the writer has put their hearts out. It's a lifelong journey of hope, healing, and growth. Even after retirement, Dr. Sohail is paying back to society. I appreciate and second the initiative of conducting the webinar series and look forward for more of such seminars aimed at helping people. Many more people are going to benefit from these sessions. I am proud of Dr. Sohail as my mentor and nurturing friend. And thank you very much. Love you all.
Okay. Thank you, Rahim Saab. We are looking forward to your coming to Toronto end of July for the seminar 1st of August and for your presentation. So we are looking forward to that. So thank you very much. So let me go back to Muqaddas because we started with Muqaddas. So Muqaddas, where are you? Can I see you on the screen? You share your comments, and then
Hello, Dr. Sohail. I'm so glad that this session went smoothly. And thank you so much to all of the participants who showed up and shared their insights. And I think this is a wonderful idea that you shared with us, that we should, pick one topic, one aspect, and then discuss it from diverse dimensions. And I can see the objectives that we discussed when you initially came up with this idea. I can see that we are meeting those objectives very closely, very successfully, and this would not have been possible without this multi-dimensional effort that everyone has made in making this very episode successful. So as we are short of time, I think that
I
I
think we
can
can
look
give
into the
five.
chat box. And
Yeah, we can
yeah.
ask 5 minutes. Anyone else, you can ask any other 10% participant if they want to make any comment or question. So you can
Yeah,
ask them.
I'm looking into the chat box if we have any questions there. Also, I request our participants, if you have any questions, please raise your hands. Also, I would like to acknowledge the efforts made by our volunteers from Naaye Khwaab team, Miss Shakila and Miss Fatima Zahra, who tried to translate the highlights from the session so that we could make it inclusive for the people who struggle with understanding English, and they translated the highlights into Urdu. Thank you, Shakila and Fatima.
Yeah,
So,
I think.
participants, please let me know if you have any questions.
Let me ask Varda and Uzma if they want to make any comments. Varda, are you there?
Oh, yeah.
Let's see if Varda has anything to say and if Uzma has to say anything.
Ji Dr. Sab, I would like to comment. Mukaddas, because of you, I feel that Dr. Suhail's clinic, the Creative Psychotherapy Clinic, it's from village of Whitby to now Global Village. So thank you so much for this effort. I really acknowledge. And Bernardine, now I'm going to read your story first in Creative Birth. Thank you. Thank you for this opportunity.
Okay,
Hello.
thank you. Is Varda there?
Hello. Yes, I'm here. I
Yeah.
was listening to the workshop, the seminar. It was just amazing. First of all, I really want to thank Bernadine for coming out and actually sharing her story. Kudos to her. It's not easy to do that. I want to share a little piece of like my personal story a little bit, if I could get 2 minutes.
Sure, go
Um,
ahead.
Okay. So I went through personally a very traumatic accident a couple of years ago. And it was a car accident where I broke multiple bones in my neck. So I have spinal infusion. I have multiple rods and screws. It doesn't look like it. So people visually, when they see me, they don't see that there is something wrong. But that is something that, is within you. And I think with mental health and these kinds of experiences, it's more about what's going on with you internally because you're not bleeding. No one can visually see what's going on, but a lot of those experiences we have, but they're much more traumatic than having something physical. So mine was a combination, and I just wanted to share that I was very fortunate to have Dr. Sohail with me because he's my uncle, and he helped me through that process in the beginning when I was at the hospital. So I was one of those fortunate people who had the first aid available in a very refined and, have the best access to the best therapist, I think, in the world. He's just amazing. So he helped me through that. And I was very fortunate that I was able to get out of that psychologically at a much better pace than any other person would. But I think at the end of the day, it's about that person, what their coping mechanism is. And I think what her story made me think about the fact that how your childhood has been has a huge impact in terms of when you come across a crisis like this, how do you get out of it? So if you have good childhood, and I think I have had a very good childhood, so it was a bit easier for me with that transition, and I had very good family and friends who were able to carry me out of it, as opposed to if you don't have that. So that's where mental health professionals, I think, come in. And in Bernadine's story, Dr. Sohail and his team was there, who pulled her out of that, dig. I would say that big shallow dig, you deep dig, you get into, and getting out of that, it's really hard. So yeah, I was very happy and fortunate to be part of this, seminar today. Thank you.
Thank you, Varda. And I think you are right. You are once when you broke your neck and you were having that recovering from accident, your mom coming from Pakistan, your brother coming, your friends, Adriana, and all people, Uzma, I think they all helped you in your recovery, and I think it was a learning experience for all of us. So thank you very much. So back to Mukaddas. I think although the time is running out, we had 90 minutes. Maybe in the future we might even think, if we need, we might say from 90 minutes to 120 minutes. If we need 2 hours, we might, but it is the first meeting. So next time, next month, 9th of August, will be Shannon, that we will explore PTSD at a different level. And I will talk about defense mechanisms and about dissociation and those kind of things. So today we touched the neurological part, the psychological, and then we will go a little bit deeper and explore some other areas next month. So Mukaddas, so anything else you would like to say before we finish, Mukaddas?
Dr. Suhail, I would like to thank you for coming up with this idea, this brilliant initiative. Since you are now retired from your clinic, but the passion to serve humanity in you, that I think that will not retire any soon. And thank you so much for this brilliant initiative, for this brilliant idea. And I have not attended any webinar in Pakistan, or even my international exposure as well, where we had this opportunity of discussing one topic from different angles, all possible angles. So this is something that makes this project very important, this series very important. And thank you so much to all of the participants. I think we are done with the session, with today's session. But if you have any important comment to make or any important question, so our experts are on board, they can entertain that.
Okay. And I think
Otherwise, we
after we
can
finish,
wind it up.
maybe Mukaddas, you and Betty and Summer and Uzma and Varda, five of you, if you would stay behind, then we will just have a little review of this thing. So Bernardine, thank you very much. I think you did a wonderful job. I'm so pleased, so proud, and so thankful that you started this whole series on a very positive, inspiring note. So thank you very much, Bernardine.
Can I just say something
Sure.
for a moment? Um, I just wanted to, in conclusion, address anybody who is suffering from PTSD right now, just to remind them that my journey did not happen overnight, and there are many obstacles that you are out of your control that you might meet along the way. But be kind to yourself. You may take a step back, but don't focus on that. Look and celebrate how far you've come, And DNA, the PTSD might always be a part of your DNA, but you can find techniques to regulate your response system and reclaim your power. And I'd like to thank Dr. Sohail, Bet, my posse in the group therapy, my family and friends, and that who I consider my family of the heart now. I want to thank you for helping me to live my life in full color again.
Okay. Thank you. Thank you.
Thank you very much, Dr. Suhail, and all the participants. Sending love and best wishes for everyone from Manchester.
Okay, thank you, Ghazi Saab. Yeah, we have friends in Scotland, England, Pakistan, Canada, America. So it was because of the internet, and I think I learned that during the COVID and with all these things. I used to be very nervous about the technology, but with the help of Muqaddas and Uzma and Varda and Betty, and so I'm
It,
learning all these things.
it
Thank you
has
very much.
really worked very well. Thank you
Okay,
very
okay,
much.
okay. Thank you. All the best. Okay, bye, bye,
Bye.
bye, bye. So Varda and Zahra and Summer and Betty and Uzma and Muqaddas, if you people stay behind, then we can have a little review.